Hello, my name is Dr. Dewan S. Raja. Today I will discuss about a few multiple choice questions in Endocrinology 5. Let's start. A 45-year-old woman with a history of type 2 diabetes mellitus presents to her physician complaining of increased thirst and frequent urination. On examination, her blood pressure is normal, but her fasting blood glucose level is elevated. Laboratory tests reveal high levels of insulin in her blood. Which of the following best explains her symptoms? So, this is question number 1, and these are the choices. A. Insulin resistance in target tissue. B. Insufficient insulin secretion by the pancreas. C. Hyperactivity of glucagon. D. Excessive glucose uptake in adipose tissue. E. Excessive glucose uptake by the skeletal muscle. So, what is the choice? Answer should be A. Insulin resistance in target tissue. This might happen after many years of type 2 diabetes. If it is uncontrolled, we may have insufficient secretion by the pancreas, but initial few decades, usually this is the insulin resistance in target tissues. This is most important in a patient with type 2 diabetes mellitus. So, insulin resistance in target tissue. This is the correct answer. Question number 2. A 30-year-old man is diagnosed with insulinoma, a rare tumor of the pancreas that produces excessive amounts of insulin. Which of the following statements best describes the expected effect of this tumor on glucose metabolism? Question number 2. These are the choices. A. Increased glycogenolysis in the liver. B. Enhanced gluconeogenesis in the kidney. C. Elevated blood glucose level. D. Suppressed lipolysis in adipose tissue. E. Decreased blood glucose level. So, tumor is insulinoma, a rare tumor of the pancreas. Okay, so what is the correct answer? Correct answer should be decreased blood glucose level. Okay, in insulinoma, a tumor of the islets of Langerhans, particularly involving the beta cells. Okay, so there will be decreased blood glucose level. Question number 3. A 55-year-old man with a long history of type 1 diabetes is experiencing difficulty managing his blood glucose level despite adhering to his insulin regimen. Upon further investigation, it is found that he has developed antibodies against exogenous insulin. What is the most likely explanation for this phenomenon? A. Downregulation of insulin receptor on target cell. B. Development of insulin resistance in peripheral tissue. C. Formation of immune complexes with exogenous insulin. D. Inhibition of insulin synthesis in the pancreas. E. Upregulation of insulin receptors on target cells. Okay. So, sometimes person with type 1 diabetes may go beyond 55 years, maybe 75 years, they may go. Usually it is a disease of the younger age group, before the age of 40, but a 55-year-old man may have type 1 diabetes. So what should be the correct answer? Okay, he has developed antibodies against exogenous insulin. So answer should be C, formation of immune complexes with exogenous insulin. Number 4, a 25-year-old woman with a family history of autoimmune disease is diagnosed with type 1 diabetes mellitus. Genetic testing reveals the presence of specific human leukocyte antigen markers. Which of the following HLA markers is most commonly associated with an increased risk of type 1 diabetes? So these are the choices: HLA-B27, HLA-DR3 and HLA-DR4, C HLA-DQ2, D HLA-A2, E HLA-C. So what is the correct answer? Correct answer is B. This is the correct answer. B is the correct answer. So, HLA marker is most commonly associated with an increased risk of type 1 diabetes is this, B. Okay, now go to the next question. Question number 5. A 30-year-old woman presents to the emergency room with symptoms of weakness, fatigue and confusion. Laboratory test reveals a significant increase in blood lactate level. Further investigation indicates a deficiency in enzyme crucial for the carb cycle. Which enzyme is likely impaired and how does this relate to glucose metabolism? A. Isocyclate dehydrogenase disrupts the conversion of isocyclate to alpha ketoglutarate, impacting the carb cycle. B. Fumarate leads to accumulation of fumarate, inhibiting the carb cycle. C. Citrate synthase disrupts the condensation of acetyl coenzyme A and oxaloacetate, blocking the initiation of carb cycle. D. Pyruvate dehydrogenase impairs the conversion of pyruvate to acetyl coenzyme a key entry point for glucose-derived carbon into carb cycle. So what is the correct answer? What is the best choice here? Best choice is D. Okay. Pyruvate dehydrogenase impairs the conversion of pyruvate to acetyl coenzyme a key entry point for glucose-derived carbon into carb cycle. Okay, so this is impaired. Okay, which enzyme is likely impaired and how does this relate to glucose metabolism? Question number 6. A 35-year-old man with type 2 diabetes is prescribed insulin therapy to help manage his blood glucose level. How does insulin facilitate the entry of glucose into cell? Okay, how it does? A. Insulin promotes the synthesis of glucose transporter protein on the cell membrane. B. Insulin activates adenylyate cyclase leading to increased cyclic AMP and glucose uptake. C. Insulin induces the phosphorylation of glucose transporters, enhancing their activity. Okay. D. Insulin stimulates the release of glucose from glycogen stores within the cell. So what is the correct answer? Okay, answer should be C. Insulin induces the phosphorylation of glucose transporter, enhancing their activity. Okay, so answer should be C. Here's a C. Okay, C. So these are the answers. That's all about multiple choice questions in Endocrinology 5. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now. Okay, these are the answers.